Hello students, today we are going to study pathogenesis and the clinical features of asthma. Asthma is a chronic inflammatory disease of respiratory tubes or the bronchial tubes, that is the air passages which conduct and distribute the air throughout the lungs. There is inflammation of mucosa and submucosa of the wall of respiratory tubes. Now asthma is characterized by the narrowing of respiratory passages causing difficulty in breathing. Now let's understand the pathogenesis of asthma. Now first look at the diagram at the figure 1. Now figure 1 shows diagram of a normal airway, that is a normal bronchial tube. This diagram represents the wall of a bronchial tube, and that is the wall of a bronchus. Now the outermost layer of tissue is termed as adventitia. Below the adventitia is present a layer of smooth muscles that is shown here in the red color. Innermost lining is the lining of ciliated columnar epithelial cells shown here in the purple color, and these are supported by the basement membrane. Now in the mucosa, which is made up of ciliated columnar epithelial cells, are present mucus secreting goblet cells. These goblet cells here are shown in the black color. Now below the mucosa is the submucosa. So this is the submucosa, and in the center is a lumen. In the center is a lumen that is meant for the passage of air. Now figure 2 shows inflamed airway in the asthma. Now as it is clear from the diagram, there is damage to the epithelium, and this damage to the epithelium results in inflammation. Now inflammation causes recruitment and activation of inflammatory cells like the eosinophils. Now these eosinophils, they are not seen in the wall of a normal airway, that is in the wall of a normal bronchus. Now there is increase in the vascular permeability because of the dilation of the blood vessels, and these blood vessels, they dilate because of the release of inflammatory mediators like histamine. Now the basement membrane that is shown here in the purple color, that also becomes very thick, and further there is thickening and overreactivity of smooth muscles, and therefore the smooth muscles, they contract, and contraction of the smooth muscles causes bronchoconstriction, that is narrowing of the lumen, and because of the narrowing of the lumen, bronchial lumen, there is difficulty in breathing. And further, because of the inflammation, there is excess secretion of mucus. Mucus here is shown in the green color. So there is excess secretion of mucus which further reduces the size of the lumen. Now compared to the lumen in a normal airway, the lumen in an inflammatory airway or the lumen in asthma is reduced. There is a reduction in the size of the lumen. And therefore asthma is a chronic inflammatory disease of air passages. There is narrowing of the lumen, and therefore there is difficulty in breathing. Now however, it's very important to note that asthma is reversible. The airflow obstruction is reversible, and therefore asthma is a reversible pulmonary obstructive disorder or a disease. Now obstructive lung disease means a condition in which there is difficulty in exhaling all the air in the lungs, and thus there is shortness of the breath. Now this is a slide that discusses pathogenesis and the clinical features of asthma. Now this is a simple schematic diagram that explains pathogenesis and clinical features of asthma. Now clinical episodes of asthma are triggered by antigens like viral infections of the respiratory tract, then inhaled air pollutants like dust, smoke, fumes. Now asthma can also be caused because of the stress, cold air, then it can also be induced by exercise, and drugs like for example aspirin. And asthma can also be caused because of the family history of disease, that is genetic predisposition. Now, because of the hypersensitivity of respiratory air passages, or because of the hypersensitivity of respiratory tract, these triggering factors, they trigger allergic response, and which causes inflammation of the innermost lining of the wall of bronchus, that is the mucosa, which is made up of ciliated columnar epithelial cells. And further, there is a release of inflammatory mediators, and the most commonly released inflammatory mediators are histamine and leukotrienes. Now, these histamine and leukotrienes, they are responsible for the hypersecretion of mucus. These inflammatory mediators, they are responsible for bronchoconstriction, that is the contraction of smooth muscles, hyperreactivity of the smooth muscles. And these mediators, they also induce increase in the vascular permeability, that is there is dilation of the blood vessels. Now, all these factors, that is accumulation of mucus in the lumen, constriction of the smooth muscles, that is a bronchoconstriction, constriction of the bronchial tract, and dilation of the blood vessels. All these factors are responsible for the narrowing of the air passages, that is narrowing of the lumen, as discussed while discussing the diagrams. Now, this narrowing of the lumen is responsible for the difficulty in breathing. And therefore, the clinical features of asthma are dyspnea, that is a shortness of breath, difficulty in breathing because there is reduction in the size of lumen. Then tightness of the chest is also because of the contraction of the bronchial smooth muscles or the respiratory smooth muscles. Cough, it is mostly productive cough, and this is because of the excess production of mucus by the goblet cells and by the submucosal glands. And wheezing is the whistling sound which is produced while breathing, because the air passes through the narrow lumen. Now, let's understand the molecular mechanism responsible for the pathogenesis of asthma. Now, factors that trigger asthma like the virus, pollen, dust particles, smoke, these all are termed as antigens. So, an antigen, here the dust particles shown in the brown color, it passes along with the air and it reaches the mucosa. Mucosa of the respiratory tract, mucosa of the bronchial tube, which is made up of ciliated columnar epithelial cells. Now, because of the hypersensitivity of respiratory tract, this antigen here, that is a dust particle, it triggers an allergic response. Now, antigen, that is a dust particle, comes in contact with the dendritic cell. Dendritic cells are the most potent antigen presenting cells of the immune system. Dendritic cells, they process the antigen, and processing of the antigen results in the production of antigen derived peptide. Now, these antigen derived peptides shown in the brown color, loaded on the major histocompatibility complex 2, shown here in the green color. These molecules are then expressed on the surface of the dendritic cells. These antigen derived peptide loaded on the major histocompatibility complex 2 are then recognized by the CD4 positive type 2 helper T cells. Type 2 helper T cells further interact with the antigen and they produce inflammatory mediators. Most important of all the inflammatory mediators are interleukin 4 and interleukin 5. Now, interleukin 4 further activates the plasma cells, and these plasma cells then produce IgE antibodies, that is immunoglobulin E. IgE antibodies bind to Fc epsilon or IgE receptors present on the surface of mast cells, shown here in the red color. Now, mast cells release inflammatory mediators. Most important of all the inflammatory mediators are the histamines and leukotrienes. Now, these histamine and leukotrienes, they cause bronchospasm, that is a bronchoconstriction. Then the increase of vascular permeability, that is the dilation of the blood vessels. There is increased production of mucus, and there is also inflammation of the mucosa. So mucosa becomes inflamed. There is inflammatory mucosa. Now, on the other hand, interleukin 5 attracts eosinophils. That means it causes recruitment and activation of inflammatory cells, that is eosinophils. Eosinophils release proteolytic enzymes, and these proteolytic enzymes, they further cause damage to the tissue of the respiratory tract, which further enhances the inflammation. So this is how in asthma there is narrowing of air passages because of the inflammation, because of the bronchoconstriction, because of the accumulation of mucus, because of the increase in vascular permeability, that is the dilation of the blood vessel, and this all results in shortness of breath. This all results in difficulty in breathing or dyspnea. So this is all about the pathogenesis and clinical features of asthma. If you like the video useful, kindly like, subscribe and share this video. You can write your questions in the comment section. Thanks for watching the video.